Hi, I'm Dr. John Gray, and welcome back to part 3 of our knee series on causes of knee bursitis and what you can do today that'll help you take care of that problem. So last week we talked about the glutes, and then the week before that we talked about the ankle motion. And last week we didn't iterate on it enough, but the glutes can also have weakness derived from dysfunction in the back or misalignments in the back. And getting those corrected can help a lot with that as well. So if you're struggling with those glute exercises and you need a little help looking at that, that's one thing to get evaluated by a chiropractor. Okay, today we're going to talk about muscle imbalances in the knee. And primarily what we're talking about is there's an inside muscle here on the knee that is usually weak compared to this outside muscle that's usually tight. How can you test for that? Well, you simply put your leg into extension like this, and you can take that kneecap, and that should move a little bit, and you can kind of move it in, and you just relax back, because you'll have this to where you're in a relaxed position, and you can push out and in. And like his goes out a lot easier than it comes in, doesn't it? So that tells us that this is tight up in here. So we're going to talk about stretches for those tight areas and things to strengthen the weak areas today. So strengthening, let's talk about the vastus medialis. So that usually is a muscle that's fired in the last 10 degrees of extension. So just that last little bit, you can put ankle weights on, you can use bands. You can do this standing in a very shallow squat, and you can use bands to give you more resistance if you need to, or you can just do it with your own body weight. There's lots of ways to do it. If it bothers you to stand because of the condition of your knee, you can put a little towel underneath the knee here and just do a small extension that way. Okay, and that's a great way to do it. And of course, there's machines at the gym and stuff that you can utilize that way. What you want to do for this outside band to stretch it, one of the best things really is myofascial work. Now, there's ways to replicate that. I personally like the method I'm going to show you in a minute. But if you can't do that method, then people use things like, that's where they use the rollers. Can you hand me that roller over there real quick? So there's different kinds. You can get smooth, you can get things with nodules on them. But you'll want to, if you're not too sensitive to it, the more nodules in this process that you can get in there, in other words, more of these little guys that are raised, and run them through there, the higher the better. That usually helps break that up quicker. That would be your strategy for the outside. So strengthening on the inside, we just talked about, and then on the outside, using things to lengthen that. And we're going to show you 3 exercises right now live. So if I was to do this, I would have the leg bare to where we could do this, and then you're just going to take your fingers and you're going to run up the leg while the knee is coming down. So if you can't see this leg is like this, and then as this leg bends towards your bum, you're going to run your hand up into that, and you're just going to, or you can run your knuckles as you're sitting there. So if I was doing it here, I would just run my knuckles up as my foot comes towards my bum. Okay, especially on that outside edge, and a little bit in the center. To recap today, usually weak on the inside, tight on the outside, makes that kneecap not track. Remember, it's like a pulley. If it doesn't track exactly right, it's not as efficient, which means all the muscles in that area are working harder, and they're usually compressing that joint, causing more wear and tear, which causes fluid to leak out of those areas or break down, and it goes and that fills that bursa sac. So the ways we combat it is to strengthen the inside, like we showed you today, and then do those stretching exercises on the outside. And like anything, sometimes there's sticking points. Sometimes if the ankle's not working or the knee gets rotated, that can be something that kind of hangs you up, and it's hard to get those areas to relax. So that's something that we treat all the time as chiropractors. So I always recommend getting it evaluated first, look to make sure everything's working the way it's supposed to, and then go ahead and go to work on some of these exercises that we showed you today. Great. Till next time, this is Dr. Gray signing out. And if you have any questions, feel free to give us a call. And don't forget to like or subscribe. Have a great day.